Anxiety, depression, burnout. These words are no longer limited to adults. Across India, a mental health crisis is brewing quietly but urgently. And it's now reaching the kids, the children. The question is, what's causing this surge? And are we equipped to deal with it? That's what we will decode in Gravitas Plus this week. Mental health continues to be a majorly neglected aspect of public health in India. National estimates suggest that 1 in 7 Indians experience a clinically diagnosable mental disorder. Yet, nearly 83% of those in need do not receive any treatment. This huge treatment gap, shaped by stigma, underfunded services, and structural apathy, has left millions navigating the psychological distress alone. While in today's day and age, we have seen public awareness growing when it comes to mental health, but the stigma and fear of judgment that remains deeply embedded in social institutions, from families to workplaces. And according to a 2017 report by the World Health Organization, 56 million Indians live with depression. Not just that, another 38 million live with anxiety disorders. Mental distress is also one of the major reasons as to why India has one of the world's highest suicide rates for youth aged between 15 to 29. By that I mean that every 1 hour, every 60 minutes, one student commits suicide in India. Before we go ahead with this, let's just tell you how is mental health defined as according to World Health Organization. Mental health, it is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and perhaps work well. Add to that, a person's mental health is shaped by a wide range of influences. To name some, treatment gap, suicide epidemic, economic hardship, social construct, lack of awareness, gender disparities, stressful life events, and environmental factors. And in India, the National Mental Health Program remains far from its goal, and that's of integrating mental health services into primary health care. But why? What's the reason? And what are the challenges lined up? Number one, overburdened primary health centers. The PHCS are already stretched thin with multiple tasks, high patient loads, and a lack of adequate staff and resources, further making it difficult to integrate mental health. Number two, shortage of mental health professionals. India faces a major shortage of trained psychiatrists, psychologists, and nurses. As per the World Health Organization, there should be 1.7 psychiatrists per 100,000 population. However, the current ratio in India is only about 0.75. Then, social stigma. Despite all the awareness, mental illness is often stigmatized, leading to a reluctance to seek help and hindering the integration of mental health services. Then, low mental health literacy. One of the major challenges is low awareness and understanding of mental health among the public and the population, which contributes to the underutilization of existing services. Now, with India's mental health infrastructure woefully under-resourced, more and more people are now opening up not to human therapists, but to chatbots, to AI. Artificial intelligence is quietly stepping into the world of mental health, with AI appearing not just as a luxury, but rather a necessity, promising instant help. But at this point of time, it also raises serious questions. At any hour of the day and night, millions are turning to AI companion like ChatGPT, seeking comfort, advice, and companion. And we understand that. Because why is this happening? Because ChatGPT, AI, they offer something that traditional therapy often cannot, which is instant, affordable, and anonymous support. And clinical trials have shown that AI tools can reduce symptoms of depression by up to 30%. In some cases, it can also predict a potential mental health crisis with surprising accuracy. However, while AI can be a bridge, it cannot replace the deep human empathy that real therapy provides. As AI becomes the default tool for mental health support, it risks replacing the very system it was meant to complement. And in the absence of the real care, it becomes rather easy to confuse programmed responses with meaningful ones. In a society where talking about mental health still carries a taboo, many people turn to AI because it's the only space where they feel they will not be interrupted, judged, or perhaps just told to be strong. A 2025 study reports that students like the anonymity of interacting with an AI chatbot, finding it perhaps non-judgmental, which we all are looking for at this point of time. However, it's easy said than done. For now, AI in mental health remains a double-edged sword, a lifeline for some, a risk for others. And experts say that healing works best when it is human to human. While we are talking about mental health, let's also talk about how a silent crisis is growing inside classrooms and in playgrounds. Children are reporting higher levels of anxiety than ever before. From exam halls to bedrooms lit by phone screens, more children are battling this invisible enemy. Experts say that it is a mix of academic pressure, social media influence, and post-pandemic aftershocks. Not just that, your child can experience depression due to a variety of factors. Number one, family history. Children with a family history of depression, bipolar disorder, or substance abuse are at increased risk. Then, temperament. Some children may have a naturally more sensitive or vulnerable temperament. Trauma. Experiencing physical, emotional, or sexual abuse can majorly impact a child's mental health. Then, bullying. Peer problems and bullying can lead to low self-esteem and depression. Academic stress, pressure to perform well in school. Then family difficulties. Lack of parental support can also increase a child's mental state. Numbers say that globally, 1 in 7 10 to 19-year-olds experience a mental disorder, accounting for 15% of the global burden of disease in this age group. Not just that, a recent UNICEF report says that nearly 1 in 7 teenagers experience mental health conditions, and anxiety tops that list. Let's first tell you what are the symptoms. Excessive worry, restlessness, changes in eating or sleeping difficulty in concentrating. These are all the symptoms that your child may experience if he or she is going through depression or anxiety. And it's important to mention here that anxiety, it just does not vanish with age. If left unchecked, it can shape a child's future. The challenge now is spotting it early and treating it with same urgency as physical health.